Hello people, in this video let us look at some medicine spotters. So what do you see here? It's not black exactly, then I would have said it's dry gangrene. This is actually frostbite. So this is the lung field. If this is the bottom of the patient, that is the posterior part, you can see in the dependent part of the lung you can see some white patches. So what is this? Severe ARDS. So the dependent parts of the lung are affected. So here they have shown you the pressure, volume, flow. What are they talking about, guys? This is about positive pressure, PEEP. Okay, so it's written here, positive end expiratory pressure. PEEP is what? Positive end expiratory pressure. Try this one. Heart. Okay, there seems to be something coming here via the superior vena cava, I feel, goes to the pulmonary vein, is it? Pulmonary artery, pulmonary artery going like this, and there's a balloon they have put here. So what do you think this is? Pulmonary artery catheter, Swan-Ganz. They seem to be monitoring something with this. They're just finding the pulmonary pressure. See if you can guess the disease. These are atypical lymphocytes, and this is the skin reaction to ampicillin. So an antibiotic, if you give, their skin will react like this. So what are we talking about? Yes, infectious mononucleosis. So who causes infectious mononucleosis, guys? Epstein-Barr virus. Okay, it's colloquially known as glandular fever. Try this one, it's not so easy. This side looks normal. Look at this. Here there is some swelling. This is a unilateral mumps. What do you see here? A tongue, very red and looks like a strawberry. Where do you see this? Strawberry tongue in scarlet fever. Scarlet fever is caused by streptococcus. Very good. So there's also something here called as a Pastia's sign, PTK. Can you guess this spotter now? You can see some insect is biting. It's injecting something, which is getting injected is actually the promastigote, okay, which is picked up by the neutrophil, and then these promastigotes become amastigotes. Okay, and then the amastigotes are released. So this is nothing but Kala Azar, isn't it? Leishmaniasis. Visceral leishmaniasis, also called as Kala Azar. Okay, what do you see here? This looks like an MRI. Brain here. What do you see here? Some lesions, multiple lesions. They have seemed to have marked some big circles. This is neurocysticercosis. So they are showing you the multiple lesions. They have shown the largest lesions. The arrows are showing the largest lesions. This happens because of tapeworm. Can you see here? Tinea solium. The tapeworm, okay? This is actually a pork tapeworm. Guess this one, guys. There is fat loss and they seem to be blaming some anti-HIV drug. So this is because of NRTI like stavudine and zidovudine. Okay, these are thymidine analogs. What is the full form of NRTI? Nucleotide. It's this one, nucleoside reverse transcriptase inhibitors, NRTI. But they did mention that S drug here. By looking at this, what can you say has happened? So right, left, lung fields. What are you seeing here? You can see dilatations. So this is bronchiectasis. See here? Circles. So this is bronchiectasis, extensive dilatation of the bronchi with thickened walls. Nice, right? So lower lobes are affected more, isn't it? In bronchiectasis. Try this one, guys. If there's palpable purpura, it is systemic vasculitis. Okay. So here they are talking about polyarteritis nodosa, vasculitis. Under vasculitis, how will you treat it? Just give steroids, okay, immunosuppressants. Try this one, guys. Some nodules here, some patch kind of thing here. What do you think this is? And what are these? So A is cafe au lait spots. Is that how it is pronounced? And these are some subcutaneous nodules. So this is neurofibromatosis. Very good. Cafe au lait spot, subcutaneous nodules. Remember, this is an autosomal dominant pattern. Okay, yes, this one. Depigmented patches here. This is vitiligo. Very good. Here the problem is with melanocytes. There are no melanocytes. Nothing to do with melanin. The melanocytes itself are not there. Let's take this as the last image, guys. So what do you think is the treatment being given here? Yes, it is acupuncture. They're using some needles, isn't it? All this comes for pain relief. The procedure looks painful, but very small pricks, I'm guessing.